Back in the 1990s, buprenorphine was available as an FDA-approved injection for acute pain, but we understood that it was being used worldwide for addiction, particularly in France and Australia. And we asked, why can't we use it here? Well, the FDA was taking time and the DEA was taking time, but we discovered that if we treated patients who had pain but also had addiction, we could use buprenorphine through the great efforts of compounding pharmacists. So we started using it quite early. And we discovered a couple of things. We discovered that the official guidelines put out by the NIH were actually wrong in terms of surgery. So when patients needed surgery, the guidelines were saying, take them off buprenorphine, but we found that if you took them off buprenorphine, they did very poorly. So we collected cases, we learned from Europe, we learned from Australia, we developed these cases and we published them, and we were the first folks that published this in the United States about how you should just keep the patient on the buprenorphine and then treat their pain in a compassionate way after the surgery. And that was ultimately recognized by all the major institutions. And we were asked to present that research at the American Society of Addiction Medicine in 2014. But we had also done another innovation. We learned through, again, reading the European literature that a transdermal form of buprenorphine could be used, and that could ease the transition when people were using heroin or people were using OxyContin. That could ease the transition to the kind of buprenorphine we have. So we also collected cases and we published that. And we were the first United States team that published that case series. And that is also now recognized as a pivotal article in the transition, in the knowledge of how to transition buprenorphine. So we presented both these findings in the Common Threads Pain and Addiction pre-conference to the annual conference of the American Society of Addiction Medicine. It was a great honor, you know, after going for many years and being in the audience, and here we were able to present to the whole country our research, and it was a great honor and a great opportunity, and I'm really glad to have been part of that.